So one of the important questions is, how much cholesterol reduction do I need if I have risk of cardiovascular disease? This issue has also been addressed recently again in the update of the American Heart Association, American College of Cardiology guidelines for cholesterol reduction. There are several changes in these guidelines compared to the previous guidelines. Number one, they remind us that many people at high risk of heart disease or who already have heart disease are not lowering their cholesterol level enough. In other words, they're either not taking statin therapy, which is the proven therapy for lowering LDL cholesterol and reducing cardiovascular disease, or they are not taking enough dose to lower the cholesterol level enough. For example, it is recommended that people with the cardiovascular disease who already had a heart attack or who already had a stroke, they should try to lower their LDL cholesterol by at least 50% above from their baseline. And this is particularly germane to people who are in the age range of 40 to 75 years of age. People who don't have prior cardiovascular disease, who have multiple risk factors for heart disease, such as diabetes or uncontrolled high blood pressure or history of smoking and so on, the minimum goal to lower cholesterol in such people is 30% from the baseline, but if possible up to 50% depending upon their risk in 10 years. In fact, there is a risk calculator which I always carry in my iPhone, that if you enter all these risk factors, you can see what is your risk of heart disease in the next 10 years. There is some controversy about that, but according to these guidelines, if your risk of developing cardiovascular disease in the next 10 years is more than 7.5% based on these various risk factors, then you should try to lower your LDL cholesterol between 30 and 50% if you don't have diabetes, but more than 50% if you already have diabetes. These are important guideline changes which remind us that we're not taking full advantage of the proven therapy with statin drugs that are available now for many years. I should also point out there are 7 different statin drugs available on the market. In the past, one of the concern was the cost, but now 5 of these 7 drugs are actually available in generic form. So the cost is no longer an issue, and many studies have shown the cost benefit in favor of using statin therapy to lower LDL cholesterol enough, because the diet is often not enough to do it adequately. In most cases, the diet treatment lowers LDL cholesterol at the most by about 15 to 20% on an average. So it's way below the 30 to 50% minimum that we're looking for. So these are some of the important considerations. In fact, the new AHA-ACC guidelines recommend that if you use statin therapy in the right dose, and if you use the right statin which can lower the LDL cholesterol effectively, you may not even have to worry about the level of LDL cholesterol. Although many people would say that we should have an LDL cholesterol of less than 100 as the minimum goal and less than 70 if you have cardiovascular disease. But according to these new guidelines, the percent reduction is more important than the actual LDL cholesterol level.